CNA Anticoagulant Fall Precautions. Welcome to the quiz. Question 1. You are providing perineal care to an incontinent female resident. You notice the labia are reddened and there is a small amount of thick, white, odorless discharge present. What is your priority action? Option A. Clean the area thoroughly with antiseptic wipes to kill any bacteria, apply a thick layer of barrier cream, and document the presence of discharge. Option B. Gently clean the area from front to back using a soft cloth and peri-wash, rinse well, and pat dry thoroughly. Report your observation of the redness and discharge to the nurse after completing care, as this could indicate a yeast infection. Option C. Ignore the discharge as it is a normal finding in incontinent women and continue with the care, focusing on cleaning the urine from the skin. Option D. Attempt to wipe away the discharge completely and note in your charting that the resident's perineal area was clean and clear. The answer is B. Proper cleaning and reporting abnormal findings are essential. Option A is incorrect because antiseptic wipes can be harsh and barrier cream may trap moisture. Treatment should be based on nurse's assessment. Option B is correct because proper cleaning from front to back prevents introducing bacteria, and reporting the findings allows the nurse to assess for a possible yeast infection. Option C is incorrect because ignoring the discharge could allow an infection to worsen. Option D is incorrect because wiping away without reporting misses the opportunity for proper diagnosis and treatment. Question 2. A resident who is on strict intake and output monitoring has just finished a 6-ounce cup of coffee and an 8-ounce carton of milk. They also ate a bowl of soup that was 4 ounces. How should you record this intake, and why is accuracy important? Option A. Check the volumes of the cup and carton. Add them together. 6 ounces plus 8 ounces plus 4 ounces equals 18 ounces. Convert ounces to milliliters. 18 ounce x 30 milliliters per Oz equals 540 milliliters. And record 540 milliliters on the INO sheet. Accuracy is vital for monitoring fluid balance, especially in residents with CHF or kidney issues. Option B. Ask the resident how much they think they drank and record that amount, as the resident's perception is most important. Option C. Only record the milk and soup, as coffee is a diuretic and doesn't count toward hydration status. Write coffee, not applicable, in the notes. Option D. Estimate the amounts and write coffee, milk, and soup in the notes section, as exact measurements are not critical for INO. The answer is A. Accurate INO is critical for managing fluid balance in certain conditions. Option A is correct because accurate intake measurement is essential for residents on strict INO, such as those with heart failure or kidney disease. Option B is incorrect because the resident's perception may be inaccurate. Option C is incorrect because all fluids, including coffee, count toward intake. Coffee's diuretic effect does not negate its fluid volume. Option D is incorrect because estimates are not accurate enough for clinical decisions. Remember, we can take your CNA exam for you, remotely and undetected, and with 85% score guaranteed, no fails, no upfront fees, no deposit, pay only after results. Message us via number in bio to schedule your session. Question 3. A resident with Parkinson's disease has a tremor and difficulty initiating movement. You are assisting them with walking to the bathroom. What is the most helpful approach? Option A. Stand behind them and gently push them forward when they hesitate, using your body to guide their movement. Option B. Ask them to stand still and wait for the tremor to pass completely before attempting to walk, as movement during a tremor is dangerous. Option C. Walk beside them, provide a rhythmic verbal cue like step, 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 and allow plenty of time for them to respond to the cue and initiate each step. Offer encouragement and do not rush them. Option D. Hold their hand and pull them gently to start them walking, then walk slightly ahead of them to lead the way. The answer is C. Rhythmic cues help people with Parkinson's initiate movement. Option A is incorrect because pushing can destabilize them. Option B is incorrect because waiting for tremor to pass may not be practical. They need cues to start moving. Option C is correct because rhythmic cues help people with Parkinson's initiate movement, and allowing time prevents rushing, which can increase freezing. Option D is incorrect because pulling can cause loss of balance. Question 4. You are providing oral care to an unconscious resident. To prevent aspiration, what is the single most important step you must remember? Option A. Position the resident on their side with their head turned to the side to allow fluids to drain out of the mouth rather than back into the throat, and use only a small amount of non-foaming toothpaste or a suction toothbrush. Option B. Use a firm-bristled toothbrush to ensure a thorough cleaning and remove all plaque. Option C. Use a toothpaste that creates a lot of foam to loosen debris and ensure the mouth is clean. Option D. Position the resident on their back with a small pillow under their head to keep their airway open. The answer is A. Side positioning allows gravity to drain fluids and prevent aspiration. Option A is correct because side positioning allows gravity to drain fluids out of the mouth, preventing aspiration. Option B is incorrect because a firm brush can injure gums and aspiration risk is not addressed. Option C is incorrect because too much foam increases risk of aspiration. Option D is incorrect because lying on back increases aspiration risk. Question 5. A resident who is Jewish and observes kosher dietary laws is served a meal with a cheeseburger. What should you do? Option A. Explain that the cook made a mistake, apologize, and remove the tray immediately. Offer to get them an alternative meal that complies with kosher laws, such as a kosher-style meal or a fish option, and notify dietary of the error. Option B. Tell them to just eat the burger and leave the cheese, as the main protein is the most important part of the meal. Option C. Say a quick prayer over the food to make it acceptable for them to eat, then encourage them to enjoy their meal. Option D. Ask them if they would like ketchup or mustard for their cheeseburger to make it more palatable. The answer is A. Respecting religious dietary laws is essential for culturally competent care. Option A is correct because it respects the resident's religious dietary laws by removing the non-kosher meal and providing an appropriate alternative. Option B is incorrect because mixing meat and dairy is against kosher laws. Leaving the cheese does not make it kosher. Option C is incorrect because prayer does not change the food's non-kosher status. Option D is incorrect because it ignores the dietary restriction entirely. Question 6. During your morning rounds, you find a new resident, who is usually alert and oriented, crying softly in bed. When you ask what's wrong, they say, "I just want to go home." What is the most supportive initial response? Option A. This is your home now. You need to try to adjust and make the best of it. Option B. Sit down next to them, make eye contact, and say, "It sounds like you're feeling really sad and missing your home. That must be so hard. Would you like to talk about what you miss the most?" This validates their feelings and offers a listening ear. Option C. Distract them by telling them it's time for breakfast and they need to get dressed and come to the dining room to socialize. Option D. You'll get to go home soon. Don't worry. This is just temporary. The answer is B. Validating feelings and offering a listening ear builds trust and rapport. Option A is incorrect because telling them to adjust dismisses their grief. Option B is correct because it validates the resident's feelings and offers emotional support without dismissing or arguing. Option C is incorrect because distraction avoids addressing the emotion, which may be needed. Option D is incorrect because false reassurance may not be true and minimizes their feelings. Great job! Don't forget to subscribe. Bye!